Bismillahirrahmanirrahim. In the previous lecture, we discussed about the classification of tumors of the stomach, and we discussed about gastric carcinoma. And most of the gastric carcinomas, they are adenocarcinomas. And among the adenocarcinomas, there are two main types. One is intestinal type and other is diffuse type gastric carcinoma. So other tumors of stomach which need some mention, they are lymphomas, then carcinoid tumors, and then gastrointestinal stromal tumor. So first we take up the lymphomas. So extranodal marginal zone lymphoma, they are most common lymphomas which occur in the GI tract. They are B cell lymphomas, and lymphomas in the GIT, they are often called as malt lymphomas or maltomas. Malt means mucosa associated lymphoid tissue. Lymphomas which arise from the mucosa associated lymphoid tissue. So the most common lymphoma is extranodal marginal zone B cell lymphomas. Then other, that is diffuse large B cell lymphoma and Epstein-Barr virus positive B cell lymphomas. They can also occur in the GIT. So pathogenesis of lymphomas of stomach, extranodal marginal zone B cell lymphoma, they occur at the sites of inflammation, that is chronic gastritis, especially if there is H. pylori infection. And then there are certain chromosomal translocations, that is translocation 11 to 18, P22, Q32, and translocation 114 and translocation 14 to 18 chromosomes. Also, there is activation of NFK beta. And how they look like under the microscope, there is dense lymphocytic infiltrate in the lamina propria of the stomach, and there are lymphoepithelial lesions, that is presence of lymphocytes in the epithelial cells, and there are reactive appearing B lymphocytes, follicles. Sometimes there may be plasmacytic differentiation, and these cells, they are positive for B cell markers, that is CD19 and CD20. So this is the gross and microscopic appearances of gastric or GI lymphomas. So there is often diffuse thickening of the wall of the stomach, and here you see the mucosal glands under which there is a diffuse infiltration by lymphocytes. So this is at higher magnification, lymphoplasmacytic infiltration. So this is another view of gastric lymphoma, diffuse sheets of lymphoplasmacytic cells. So clinical features of lymphomas, they often resemble peptic ulcer. Clinical features like dyspepsia, epigastric pain, there may be vomiting of blood or presence of blood in the stools, and these patients, they often show weight loss. So clinically, they are similar in symptoms and signs as with chronic peptic ulcer disease or chronic gastritis. So then is carcinoid tumor of the stomach. The carcinoid tumors, they rise from diffuse components of the endocrine system, neuroendocrine cells, and the sites of carcinoid tumor are small intestine, stomach, then tracheobronchial tree in the lungs, and there may be carcinoid tumor in the ovaries as well. They are well differentiated neuroendocrine carcinomas, and grass and microscopy of carcinoid tumors. These tumors, they form submucosal masses, or they may be intramural, or sometimes they may produce a polypoidal mass region, and mucosa over the carcinoid tumor may be intact or there may be ulceration, and the color of carcinoid tumor is yellow in appearance or tan in color, and they are firm in consistency. Microscopically, there may be arrangement of cells in the form of islands, trabeculae, glands, or there may be sheets of tumor cells. And the tumor cells, they are uniform cells. They don't show any marked pleomorphism like carcinomas or other malignant tumors. And their cytoplasm is pink granular. And if we perform immunohistochemistry on these tumors, that is carcinoid tumors, they are positive for synaptophysin and chromogranin A. They are neuroendocrine secretory products. So this is the grass microscopic and electron microscopic appearances of carcinoid tumors. So this is the intestine. So there is a polypoidal mass in the lumen of the intestine, and this is the microscopy H&E stain. There are sheets of uniform cells with stippled chromatin. The chromatin pattern is called salt and pepper chromatin. So these cells may be raised in the form of islands or glands or sheets. And this is the electron microscopy. So here you see the electron dense secretory granules, neurosecretory granules of chromogranin or synaptophysin. So then is gastrointestinal stromal tumor. So this is a most common mesenchymal tumor of the abdomen, and it is more common in males, and the age of presentation is 60 years. So pathogenesis of gastrointestinal stromal tumor, which is abbreviated as GIST. So there is gain of function mutations of gene encoding tyrosine kinase c-KIT or CD117. So this is the most important mutation, that is tyrosine kinase c-KIT. Or sometimes there may be mutations in platelet-derived growth factor receptor, and the cells of region of gastrointestinal stromal tumor is interstitial cells of Kajal, which are the cells which are involved in the peristalsis movements. Gross and microscopic. These tumors may be much large in size. They may reach as large as 30 centimeter in diameter, and they may be often they are solitary and well circumscribed fleshy mass formation. And microscopically, there are two main patterns or types of cells which are seen in gastrointestinal stromal tumors. One is spindle cell type, that is the cells, they are spindle shaped with scanty cytoplasm. Other is epithelioid type of cells, that is they have more cytoplasm as compared to spindle cell type, epithelioid type, or sometimes there may be mixed population of cells, that is spindle cell type or and the epithelioid type. Both cells they are present. So this is the gross and microscopic of gastrointestinal stromal tumor. So there is a well-formed, well-circumscribed polypoidal mass, and you see the large tumor mass. So this is the microscopic appearance. There are bundles of spindle-shaped cells, and this is an immunostain, CD117. So CD117 is positive in gastrointestinal stromal tumors. CD117 is also positive in certain other tumors as well, like seminoma or sometimes in melanoma. So most common tumor which shows CD117 positivity, they are number one, gastrointestinal stromal tumor and seminoma, and then melanoma. So that is about the other tumors of the stomach, in addition to gastric carcinoma, lymphoma, and then carcinoid tumor and gastrointestinal stromal tumor. So that is about the gastric polyps and tumors.